Now we know a little about vaccines and their storage. What about giving the vaccines to babies, infants and mothers? How do we do this safely and effectively? Immunization safety covers vaccine safety and quality, safe injecting technique, waste disposal and surveillance of adverse events. If you follow immunization safety principles, the risk of disease transmission and preventable adverse reactions will be reduced. It also ensures the effectiveness of vaccines and proper case management. All vaccines except OPV and rotavirus vaccine are given by injection. The most widely accepted method these days is using the auto-disabled syringe. Using syringes only once avoids cross-infection, which was common with reusable syringes, and so is much safer and more convenient. Before handling syringes or giving injections, remember to wash your hands thoroughly. Infections passed between patients on the hands of health staff is a serious problem that can be prevented by washing your hands between patients whenever possible. Remember to use a clean towel to dry your hands. As you know, vaccines come in different forms. Some can be used straight from the vial, some need to be reconstituted with a diluent, and others are taken as drops. Those needing to be reconstituted are BCG, measles, MR and MMR, meningococcal and yellow fever vaccine. You must always use the vaccine and its matching diluent cooled to the same temperature as the vaccine. Never use sterile water or normal saline as a substitute. The reconstituted vaccines can be used up to 6 hours after preparation, but must then be discarded. During the day, keep the vaccine in the refrigerator or vaccine carrier so it remains between +2 and +8 degrees Celsius. Make a note of the time it was opened, and do not allow open vials to become submerged in water. When ready to give an injection, remove the wrapping from the syringe and the cap from the needle. Insert the needle into the vial and withdraw the plunger. To remove air bubbles, hold the syringe upright and tap the barrel. Do not touch the needle or the collar of the syringe. Give the injection. You will notice the plunger will lock so it can't be withdrawn. Discard the syringe and needle into the safety box. Do not recap the needle. Injectable vaccines are given in one of 3 ways. The first is intradermal, which is into the top layer of skin. The second is subcutaneous, the layer below the skin. And the third way is intramuscular, deep into the muscle. Before giving an injection, place the baby on the parent's lap so movement can be minimized. The site of the injection is wiped with damp cotton wool to remove any surface dirt. BCG is administered using an intradermal injection, which aims to go under just the top layer of skin. The needle is kept flat along the arm, with the bevel facing upwards. Just the bevel and a little of the needle need to be pushed into the skin. Measles vaccinations use a subcutaneous approach and go into the arm at a 45-degree angle, so the vaccine is left in the tissue below the skin. The injection is given with the bevel of the needle facing up, under the flesh that you pinch between your thumb and forefinger. Most other vaccines use intramuscular injections. These go deep into the muscle of the thigh of babies under 12 months, or into the arm of older children and adults. Stretch the skin flat between your thumb and forefinger, then press the needle straight down. The plunger is pushed with your thumb to inject the vaccine. Polio vaccine is one of the 2 vaccines that doesn't need to be injection. Oral OPV drops are used. First, the child's lips are pursed, then 2 drops of the vaccine are allowed to drop onto the tongue. The other vaccine is rotavirus vaccine, and greater care is needed because of the large volume of fluid to be given. Administer the liquid slowly down one side of the inside of the cheek, between the cheek and the gum, toward the back of the infant's mouth. Take care not to go too far back, which could initiate the gag reflex. And never squirt the vaccine directly into the throat. Vitamin A, which is part of the immunisation program, is also administered as drops. It's important to remember giving babies BCG and Hep B vaccine on day 1 of life protects them more effectively than if the vaccines are given 2 or more days after birth. Mothers who give birth in the village should be encouraged to bring their babies to the health centre for immunisation as soon as possible. Shortly after the birth, the mother should receive TT if not recently immunised, and should also be given 200,000 international units of vitamin A. After immunisation, warn the mother or caregiver about any adverse reactions that may occur when babies are immunised. An adverse event following immunisation, or AEFI, is defined as a medical incident that takes place after giving the vaccine, but not necessarily caused by it. AEFIs are classified into 5 main types: vaccine reaction, program errors, coincidental, injection reaction, and unknown causes. You must be able to detect AEFIs yourself, educate parents to monitor them, and implement appropriate and immediate action when they occur. If necessary, refer the problem quickly to the hospital. Injection safety can be a real concern for health workers as well as their clients. Each year there are many needle stick injuries that can lead to serious infections with bloodborne organisms such as viruses and bacteria. All these can be avoided if strict safety procedures are followed. The key things to remember are: handle syringes and needles as little as possible. Do not touch the needle itself or the collar of the syringe. Position the child so any squirming or movement can be minimized. When giving injections, have a safety box nearby so you don't need to walk to it. Do not recap needles, just drop them needle first into the safety box. Seal the safety box when it is 3/4 full and open a new one. Safety boxes and the syringes they contain need to be returned to EPI management to be destroyed as soon as possible after the session to minimize the chance of accidents. The boxes will be burnt in the special EPI incinerator by staff who know how to handle them. It's important to make sure children and animals do not come into contact with used needles and syringes, so make sure all waste material is taken from the village after the session. Remember, mix dried vaccines only with their own cooled diluent. Use the appropriate injection technique for each vaccine. Keep the vaccines between +2 and +8 degrees Celsius all day. Prevent infection. Wash hands thoroughly. And monitor any adverse events following each immunisation session.